What would you say if I told you there was a group out there praising dictators, calling for restrictions on affordable food, opposing life-saving technologies for smokers, and doing all of this with your tax dollars? You'd want their funding cut, right? Well, the World Health Organization, or WHO, does all of these terrible things, and they do it with your money. As an example, during the 2013-14 Ebola crisis, it took the WHO months to do anything about the outbreak because they didn't want to upset some West African dictators. Instead, they chose to focus on campaigns against unhealthy lifestyles. Many people died, the Ebola virus spread, and the WHO did nothing. And when they're not trying to avoid upsetting dictators, the WHO is actively trying to schmooze them. Just like when the WHO Director General Tedros Adhanom named Zimbabwe's longtime dictator Robert Mugabe a goodwill ambassador of the WHO. Only a massive public backlash made him reverse that decision. Finally, the WHO spends $200 million a year on travel. That's $28,500 per staff member, or the per capita GDP of developed countries like Spain or Italy. And it's coming out of our pocket. In comparison, effective non-profit organisations like Doctors Without Borders spend merely a tenth per staff member. It's time to cut the funds of the WHO and allow real and effective medical organisations to take the lead.